I'm Jacob Nelson, registered nurse. I started in nursing when I was 17 as a CNA and just lifting heavy people. You know, as a young man, you're like, I'm tough, I can do it all. But it has its price. And I think that what happened actually was I was leaning over a patient's bed one time and I twisted wrong. I felt a pop and just shooting pain. And ever since that time, I just had this horrible pain either in my back or my legs. And then I went on to nursing school in my early 20s. It got so bad to where I don't know if it was contributing from riding my bike a lot, just trying to stay active, but those the glute muscles in your butt and back get tight from just running, biking. At one point I was kneeling in class because anytime you sit, those muscles get tense and tight, and then when you stand up, it's just even worse. So, I mean, imagine being in class and kneeling all the time, just couldn't sleep at night, a lot of pain. You know, I've been to many chiropractors because, you know, when you're in pain, you seek help. And I think I just ended up Googling it. I saw the Google ratings were good. I was like, oh, this looks like in it. And I'm a big fan of natural health, natural healing techniques as opposed to medication and invasive procedures. So it was kind of a clear option. I went there. I liked the environment, and Dr. Schubert said, you know, have you ever had an x-ray done? I'm like, no. Of all the people that I've been to, no one ever asked that.
So let's see what we got here. So here's where we started with him on, let's see, that was July of 2016, and this is March of 2021. And you can see how we've got the spine's curving towards that short leg, and we've got about that 16 millimeter deficiency. And we've, on a gradient, built up and put a lift in, and ended up with a 12 millimeter. And now his spine is straight and not much deficiency here.
And it didn't seem simple at the time, but now that I'm looking back at it, I was like, man, that was just like common sense. Why hadn't anyone else thought of that? So we took an x-ray, and sure enough, one of my hips was 1 centimeter below the other. So they were 2 centimeters apart in elevation. One leg was shorter than the other. And that was throwing my whole back out of alignment. So I had an orthotic put in on my right side to kind of raise that leg up. And, you know, my pain went away almost immediately. Almost immediately. We started with a less thick one and then moved up. And then I was just, you know, I go to the gym a lot, and I'm pretty physically active. I try to stay healthy. And when you're having that pain, that's often hard to do.
Because when your spine is straight, it's a wonderful thing, because then you get nerve supply to your organs and your joints work correctly, and the body's much happier that way.